Thank you. Thank you. Congrats, man. Thanks, man. Thanks.
Good job, man.
James, can I share with you
Hey.
for this?
I'll get to it, okay? Just give me some time. What is it with these headaches?
But they're like selling some like tourist like gifts.
Hey James, do you want to go and get lunch?
No. I can't make sense of anything. This shouldn't be so hard.
Mom, I think I need help.
What's the purpose of life?
Hi, James. How are you feeling today?
I'm better now.
It's great. Do you feel any sad feelings going on?
Less and less. Now I try to talk to my friends more.
Finish up for this month.
Your thoughts are nothing less than billions of neurons firing electrical signals every second of every day. Electrical signals that influence everything. They produce the emotions that make us tingle. They govern how we share our excitement. Even the memories we form and recall rely on the billions of connections in our brain. But all it takes is a tiny imbalance in one chemical messenger, or a single signal out of place, for thoughts to become jumbled, or for memories to disappear altogether. For us to feel our world is dimmed or slowly turning into darkness. To disconnect with our own body. Or to make us lose trust in reality altogether. While the challenge is immense, it cannot be left unsolved. Every day we work tirelessly to flick the switches on brain disease. Decades of hard work and commitment have taken us far. And while there's still a long way to go, we keep pushing forward in search of better treatments. Because one day, we hope the light will burn bright for everyone.
Hello, everyone. Good evening and welcome to the live conversations with Doc Lu and friends. This is part of the Mind Care podcast, and we've been away for a while. I think our last live conversation happened in June, and so we're back after this very short hiatus. So, good evening to all of you, and welcome to the live conversations. Our topic for tonight is entitled brain fog. Is it a symptom or a disease? The concept of brain fog was something that has been asked continuously by a lot of people, laymen and professionals alike, especially in the context of COVID. So tonight we're going to approach that topic head on, talk about it both in terms of what are the perspectives in terms of causes, and then what can we do to manage brain fog. So, good evening to the Mind Care Club live conversations. And this episode is brought to you by our friends from Lundbeck, one of our pharmaceutical partners in promoting improved access to mental health care. So, let me welcome tonight our guest, who's known to many as a psychiatrist par excellence. He is a past president of the Philippine Psychiatric Association and the Philippine Association for the Study of Overweight and Obesity. He's the current chairman of the Department of Psychiatry and Mental Health at the Quirino Memorial Medical Center, and also a member of the Philippine Council for Mental Health, representing professionals and health organizations. Dr. Ed Tolentino is an international fellow of the American Psychiatric Association and recently worked as associate editor of the Oxford Textbook of Social Psychiatry. So, ladies and gentlemen, our friends of the Mind Care Club and Lundbeck, please welcome Dr. Edgardo Juan Tolentino, someone we lovingly call and fondly call Ed Tol. Hi, Ed Tol. Good evening.
Hi, Lou. Good evening, and good evening, everyone at Mind Care Club.
Thank you very much for joining us tonight. This is the second time we're having you with Mind Care Club. No? The last time was in April when we
Yes,
were talking about the
that's
new
right.
normal. So, ang dami nang nangyari since that episode.
Sobra,
So,
sobra.
and it's amazing, no?
Sigur
Yeah, go ahead.
Siguro, Lou, I mean, this comes at an appropriate time because it happens to be the celebration of Mental Health Month.
That's right.
So really very appropriate to have this talk. As you said, you were on hiatus, and being alive again at this particular time. Swak na swak sa ating
Oo.
celebration.
Totoo yan. Well, alam mo, this is also the second year that Lonbec has partnered with Mind Care Club to celebrate the Mental Health Awareness Month. Actually, dati, it was really just Mental Health Awareness Day, which was the 10th of October.
Right.
But now I think we've really extended the celebration to mark the whole of October. So, talagang this was meant to celebrate that. So maraming salamat sa iyo at sa Lundbeck for gracing this celebration tonight, no? So
Always a pleasure.
oh, thank you. Thank you so much. So what are we going to talk about tonight? So, to everyone who's listening in or joining this live conversation, feel free to join us and then type in your questions, put it on the chat, and then feel free to ask whatever it is that's on your mind about this topic. Ang daming nagtatanong tungkol sa brain fog dun sa Messenger tsaka Facebook page ng Mind Care Club when we started posting it. So, siguro, let's start by just defining it. Ano ba talaga 'tong brain fog at ano, is it a phenomenon? Is it a symptom? Is it a disease? What is brain fog all about? Ed?
It's first and foremost, interestingly, it became a phenomenon when people after having COVID noticed that there were particular changes.
Hmm.
And in fact, we are talking about a third of all who have COVID started displaying either psychiatric or neurologic symptoms. And it also became attached to the concept of long COVID because 1 in 5 individuals actually would have after the acute phase of COVID certain symptoms pa rin for the next 5 weeks, and one in
Hmm.
10 will extend it for the next 12 weeks. Now, one thing that kind of stood out was really this parang lack of mental clarity, sometimes confusion, nandyan yung minsan forgetfulness, parang ano na nga ba yung dapat
Oo,
kong tandaan, where are my glasses, and so on and so forth, no,
true.
forgetfulness. Or yung attention was already affected, decision making. Tapos yun nga, pumasok yung term which has been actually ascribed to other conditions, and that is brain fog. So
Mhm.
it's just one of the symptoms, and if you have a collection of symptoms, then some authors were actually considering it as a syndrome, which is a collection of related symptoms, okay, that seem to be recurring more and more often. However, I think it's fair to say that when we talk of brain fog syndrome, it isn't exclusive lang to COVID because we've heard of this in other conditions, in other situations, not necessarily a condition.
Right. So that really means when you clarified it, Ed, is that brain fog has been existing for a long time. It's a common experience for many, many reasons, but it just became more commonly discussed when COVID happened. So I think it's very
Correct.
apt to say brain fog, no? Kasi ang nangyayari talaga, parang may fog yung utak. No,
Right.
nababalutan siya ng fogs kasi nawawalan siya ng mental clarity, eh.
Clarity. Oo. Tapos yung confusion nga,
Yung confusion,
nalilito.
forgetfulness.
Tapos nagiging malimutin bigla na part to age, yung mga ka-age group na either hindi nag-COVID or other conditions,
Hmm,
hindi naman nagkakaganon. Of course, marami pa
mm.
tayong pwedeng pag-usapan diyan because
Oo,
a lot of other conditions may fog the issue of brain fog, o 'di ba?
that's true, that's true. So, to clarify, brain fog in itself is not an illness. 'Diba? It
No,
is
it's
a
not an illness.
symptom. It is actually now being clarified as a syndrome, which is actually
Syndrome,
a collection of different kinds of symptoms that
symptom.
pertain to just the clouding of the mind. And that
That's right.
can come in terms of loss of memory or at least lapses in memory,
That's right.
manifested as forgetfulness, lack of clarity of thought. So, yung nagsa-stammer ka na, 'di ba, yung parang it's at the tip of your tongue pero nakalimutan
Right.
mo yung gusto mong
Kung
sabihin.
ano. That's right. Dun sa COVID, Lou,
Oo.
what they noticed was that meron mga psychological symptoms na related siya, may behavioral changes,
Mhm.
on top of the cognitive impairment na katulad ng sinabi natin na yung lack of mental clarity, confusion, and all that,
Mm.
meron pa rin nung iba. Kaya nga, they consider this parang syndrome na nga, a
Oo.
collection of the different symptoms. This seems to be coming out from studies on long COVID.
That's right.
And ang nakakatakot nito, since we're on the topic ng COVID, no? They are now seeing after some meta-analysis na this may not just be for a while. Nagkakaroon
Mm.
ng chronic cognitive consequences. In fact, pinag-aralan nila as much as almost 85,000 COVID survivors, and they
Mm.
found na worse ang kanilang performance cognitively sa mga tests. So they subjected these individuals sa mga tests along the different domains ng cognition, whether it's decision
Mm.
making, it's working memory, excuse me, focus, concentration, and they found that the cognitive impairment is a lot. It could range from 40 plus to around 65 percent of those particularly who were hospitalized for COVID. So medyo, hindi just. We need
Oo.
to consider this quite seriously. And in particular, ang nakikita nila kasi, these are people in the very productive age group, no?
That's
Mga
right. Yeah.
below 40. So, and ang na-affect sa kanila, particularly short-term memory in this particular study, yung attention, okay, which
Mm.
is basic. Kasi kung hindi ka attentive, hindi mo ngayon ma-store yung napuna mo o pinag-aralan mo o
Mm.
binasa mo at wala kang recall later on, no? And
Mm.
of course, concentration. And this is the thing. It didn't matter if you had severe or mild COVID, no? So
Yeah.
it was occurring even amongst those with just mild symptoms of COVID
Mm.
ab initio. Okay,
Right.
so these are fairly new, medyo hot off the press, so but very very interesting, no?
Oo. Fairly new studies, and I think we will uncover more of the long COVID, and it's now what they call a long COVID autonomic dysfunction, eh, kapagka
Correct.
nagkakaroon tayo ng brain fog as a result of COVID. So
Mm-mm.
hopefully, as you said earlier, it could resolve anywhere from the 4 to 12-week period after the
Yes,
infection. But of course, this is
correct,
still a moving target, no? We don't
correct. Oo,
know what else is going to happen. So I guess prevention is still, as far as COVID is concerned, really improving your immune system and
right.
prevention of avoiding any direct contact is always going
Mm-mm.
to be the way to go.
The health
Kasi you never,
protocols are still valid, the
yeah,
masking,
oo,
distancing, and all that. Yeah,
right,
definitely.
right. Ang galing. So anyway, yung isa pang napag-usapan natin as other than COVID, 'di ba? Ang isa pang puwedeng mangyari with brain fog is it can be caused by life circumstances, 'di ba?
That's
Puwedeng
right. Yes.
stress or being
Oo.
overworked.
Itong nangyari sa atin, a lot at the beginning, 'di ba? We were not sleeping well. Nasira yung ating
Sira ang
sleep cycle. So, you could imagine, 'di ba, amongst workers na hindi natutulog na mabuti, watching and all that, which was an additional thing na nangyari sa COVID. Dinadaan natin na whole night watching or going into gadgets, looking
Mm,
into social media for the latest news, etc. So nagkanda puyat-puyat, and obviously that can also cause problems sa cognition the next day. And
right.
then nabanggit mo yung stress. We know that stress is correlated to a lot of factors. No, stress can lead to depression. Stress can lead to anxiety. Stress can lead to inflammatory conditions if you're going
Inflammatory
biological, and
yes.
we could go there also. No, so hindi lang talaga we could go beyond COVID per se as the possible cause of brain fog. Let's not forget, because women were the most affected by the pandemic,
Right.
a lot of conditions related to, menopause, for example, postpartum conditions. We have known that all along that
Mm,
they may actually be related to cognitive deficits after giving birth, di ba?
mm,
Or within the menopausal period. So these are a lot of the other conditions that we should also consider para hindi naman isipin ng lahat. Nagka-COVID ba ako? Hindi ko alam. Kaya ako nagkaka-brain
Like
fog.
baka
There
nagiging
are.
nakakalimutin.
Oo,
Oo.
malilimutin. So maraming conditions, no, na nagko-cause nito.
Oo. Yung sa, point on women, I think very important factor kasi, women really in any circumstance I think underdog siya on many
True.
fronts. And the thing biologically that differentiates the effect of all of these illnesses on women, including, brain fog, is hormones.
Hormones, right?
So nakita mo yung ano, yung sabi mo nga menopause at saka in the postpartum phase, it's really the period in a woman's life when ano, nagfa-fluctuate ng husto yung hormones, and so women become irritable or become forgetful or become just not focused. And I think that correlates with what a lot of other young women now call mommy brain, mga
Or
mommy.
mamnesia,
Oo,
nagmamamnesia.
momnisya. Oo, ang tawag nila ngayon dun is momnisya kasi nagiging
Oo,
makakalimutin sila. Aside from the hormones, I think it's also the lack of sleep that can happen during
true.
this both because both menopause and postpartum are periods where you can have insomnia.
That's right. Yeah.
And it's a physiologic kind of insomnia. So, just to say, oh, hello, Marcel Bala. We can see you're in the audience and you're saying hello to us and to Dr. Tolentino. How are you? Thank you for joining us tonight. So, we've discussed the concept of brain fog, the various causes. It's not a symptom; it's actually a syndrome of conglomeration of symptoms that come together, and then the various causes of brain fog, COVID including, but not
Correct.
only COVID.
Not
So,
only. Right.
lifestyle. What about lifestyle? Can lifestyle
Oh,
actually cause
definitely.
brain fog? Can you address that?
Especially, yeah, especially nitong nangyari sa ating pandemic, sleep is a very important lifestyle issue that messed up, our cognition, our emotions. If you're sleepless, you will be irritable the next day. You're not going to concentrate very well. You'll be sleepy, etc. And of course, it will affect our immune system. So sleep is a very important factor that was very much affected during this pandemic. Then, of course, because nagka-halo-halo na yung ating work sa regular life, sa whatever, sa
Hmm.
entertainment natin, it was all messed up. We were practically in front of our gadgets, computer, cell phone, and what have you, almost 24/7, and
Hmm.
that was sending blue lights that doesn't allow us to actually have proper sleep or messed up our sleep wake rhythms, no, our cycle.
Right.
Obviously that's another important issue. So yun yung mga sa mga lifestyle na naka-affect sa atin,
Mm.
particularly during this pandemic, no?
Pandemic, oo. There's a comment from this is a classmate of mine from med school and is a general practitioner here in New Zealand. Dr. Elvinario Anderson put in a comment that sleep is a true brain fogger. Yeah,
True.
so if you lack
Totally
sleep,
agree.
yeah, totally. Like if you're, I know Ed, you're jet lagged, so I think this is
Medyo.
one ano for the brain fog, and it's very late for me here. So kung magkaroon po kami ng brain fog, pasensyahan nyo kami tonight ha. But
Pasensya na ho
doing my
kayo.
best to explain this to all of you. There's a question from Marcel Balao about how young can you experience brain fog?
This is interesting. Although very common, yung mga active from 18 to 29,
Mm-mm.
especially if you've had COVID, this is the age group na very prominent ito. But even for young children, there are other lifestyle factors, and we know this. Kids who do too much sugar, yung sugar rush, will
That's right.
affect, they become so overactive, they will not parang may ADHD, which we know is a problem also, na parang brain fog kasi hindi the attention is actually off, totally off. So even those kids, we see that, no, very common sa mga kids na nagkaka sugar rush, but we are focusing on this as symptoms of the lifestyle changes, or things like that, no?
Mm.
There could be other factors related, of course, to lifestyle among kids that can affect their focus, their attention.
Hmm. So I guess the answer that you gave to Marcel is that it can happen to anyone, not young and old alike. We're seeing the phenomenon in COVID that it's affecting the ones who are younger between the 18 to 29 years old. But there are several causes of brain fog, and so it can vary. So katulad nito, yung
That's right.
menopause at saka postpartum females at different
Right.
stages of life, no. So I guess talagang if it happens, it is our responsibility to actually notice that something is happening either to ourselves or to people we work with or live with, kasi mapapansin natin ang pagbabago pag nagkaroon ng brain fog. You won't miss it kasi
Right.
very acute yung change as opposed to dementia where the change is very gradual. With brain fog, the change is very acute. Kitang-kita mo na, "Oh, nagbago siya. Bakit
Mm-mm.
bakit naging iba na yung mag-isip, hindi na maka-analyze, hindi na maka-memorize," 'di ba?
But that's an important thing that you mentioned there. And I think it might be important to focus also. Am I getting demented? Baka may nakikinig sa atin 65 and up,
Mm.
uh, na either nag-COVID or not, uh, how do I say na ano ba, brain fog lang ba to?
Kung
Chill lang
nagde-dementia
ako
na ba
or
ako?
nagdi-dementia na ako, no? Kabahan na ako, no?
Mm.
Hindi ba? This is an important question, and of course there are, from what we have discussed already as symptoms of brain fog, these are also symptoms of dementia. So there are commonalities, no? But
Right.
in psychiatry kasi, the thin line, 'di ba? Ito yung simplified explanation. The thin line is crossed when functionality is already
Is
affected.
affected, right.
'Di ba?
Agree.
Hindi na ako magkano nga pala ang sukli? How do I
Oo,
compute? Yung finances are already affected.
affected, yeah.
Social life, hindi ba, nagwi-withdraw na. What they used to be very familiar with and comfortable doing, mahjong or something, hindi na nila masalat at
Hindi na makasala.
matandaan kung paano ba i-combine yung mga numbers, So
Oo.
when once functionality is affected, that's, I think, one of the most important overall, although iba nga yung onset, nabanggit mo na Lou, no?
Mm-mm.
Mas gradual yung dementia. Yung insight usually hindi nakikita nung somebody with dementia that it has already caught on.
Mm.
Usually pagka brain fog, especially related to certain conditions that we have already mentioned, mapipick up niya, there's something really wrong with me. I can't
Mm.
put a finger. And of course, nandiyan yung mood na may be more affected, especially with the certain kinds of dementia. Meron ng behavioral symptoms, in fact, ang dementia. And of course, yung vegetative symptoms. So, nag-change yung
Right.
day-night na cycle, etc. So, these are important differences, but there are indeed similarities. And therefore, pagka may ganyan and medyo naglilinger beyond yung right now the studies nga umaabot na up to 12 weeks, etc., or more,
Mm-mm.
then perhaps it does help to see a health professional.
Health professional. There's a
uh,
question from Paula Guillermo. Are those working in the BPO who have messed up body clock and sleep patterns more susceptible to brain fog?
there's a big study. That's a very interesting study. And I have a colleague na ang focus ng study niya is on sleep. And it's
Mm.
quite interesting kasi apparently iba-ibang phenotype natin with regards to sleep. Merong bagay na pang BPO and they will really thrive. So the
Right.
word
Yeah.
thriving, but there are na talagang no matter what you do, hindi ka babagay, and it will really cause a mess in terms
Mm.
of not just physical, emotional, but also cognitive. And in this case, yun nga, it will appear as brain fog. So
Right.
yes, especially certain individuals na hindi sa phenotype
Hindi,
nila yung
oo,
mag
hindi sila
mag
dapat pang shift
oo,
work
ang
o
shift
night
work.
shift.
That will
Oo.
be really problematic. And I think
Agree.
we get referrals na ganon, di ba, Lou?
Oo. Madami
Uh,
actually tayong patients from the
oo,
BPOs eh, na
BPOs, yeah.
ano,
And
may ganyang
hindi lang yung sleep ang nagiging issue, nagkakascade into depression,
depression and anxiety.
anxiety, and all that,
Mm.
no? So, yun ang mahirap.
Dr. Anderson also posted two comments. So most of COVID-related brain fog I see in clinic are anxiety-related insomnia.
True,
And the
true.
other comment was MRI of the brain will differentiate COVID brain fog versus dementia.
Right,
That's very
also,
true.
yes, very important, right.
Mm-mm.
Uh,
Yung ano, anxiety-related insomnia, that's also very true. Yung, especially if there is health anxiety, naging lumabas din ang lahat ng anxieties when COVID
right,
happened, di ba? Nagkaroon ng maraming health
oo,
anxiety at social
true,
anxiety because
that's
of
right.
the virus. Okay. I think ang isang sa malaking topic na kailangan nating pag-usapan is brain fog and depression.
Right,
Kasi
and
ano
perhaps ito yung mas comfortable tayo
oo,
being psychiatrists.
oo, tsaka yung depression kasi is really the biggest source of disability for globally, hindi lang sa
Right,
Pilipinas. Globally, talagang maraming apektado ng depression. And then with COVID, lalong
ay
tumaas
lalo
ang
pa, oo,
kitang-kita sa clinical work, 'no? As
that's
psychiatrists, both
true.
Ed and I see a lot of patients who have been depressed and anxious as a result or I think na-push na lang ng mga pangyayari related to COVID. So, depression as an illness is of course has available treatment, hindi ba? Pero brain
That's
fog
the
in
hopeful,
depression,
yeah.
madami. Can we talk about what happens to brain fog in depression? How is it
Okay,
defined? Ano ang karanasan ng mga, patients na may depression and how
okay,
will they know it's brain fog?
okay. Generally, there uh wait, before we clarify, in depression, we could differentiate the three main domains of symptomatology.
Right.
What is mostly talked about would be the emotional domain. I feel depressed, I don't have interest in usual things. But indeed, and we have talked extensively about the physical domain.
Mm-mm.
Sleep is affected, appetite is affected, even sex life is affected, and then the most important is, and the most the domain which has the greatest impact on functionality would be the cognitive domain of depression.
Mm-hmm.
And in depression, brain fog is more experienced by the individual as impairment in their executive functioning, which is
Mm-hmm.
sad because that has to do with decision making.
Right.
And they seem to ascribe this to a problem in the frontal lobe that is, in fact, responsible for organizing, planning, and decision making.
Mm-mm.
However, in terms of behavior, we externally, the one observing somebody who's depressed, might actually see this as hesitation kasi parang pag-iisipan pa muna, parang hindi very spontaneous ang pagsagot, no?
Mm-mm.
Problems with planning because you need to plan, 'di ba? Medyo complex na activity ang planning, no? As well as uh, problems, they will appear as having difficulty in making decisions sa mga depressed. So,
Mm-mm.
in the last couple of decades pa lang naging focus ang cognition in depression. Used to be, ang pag sinabi mong problems in cognition, you're talking about schizophrenia or bipolar disorder because these are very serious mental illnesses. However, in the last few decades, nag-refocus sila na very characteristic yung ito nga, now we're terming it tonight as brain fog in depression, but in a more uh, general term, these are the cognitive problems or the impaired cognitive domain in depression. No,
Mm-mm.
based on studies, okay, particularly sa acute phase, no, when you just had the acute symptoms of depression, what seems to be impaired in 14 different studies are they highlighted inhibition. So yun nga, yung it will appear as hesitancy, uh, problem solving as well as planning, mental flexibility. We saw that also sa mga patients who come from COVID infection. I mentioned decision making, working memory. This has been well studied sa depression as well as verbal fluency. Now the problem with this is that uh, even if with the improvement in the depressive symptoms, particularly the emotional and the physical, what seems to be lagging are these cognitive domain symptoms.
Right.
Kaya tuloy, ito, and this has good, important implications for us doctors. Just because, kanyari, we assess the patient, okay, hindi na siya depressed. Okay, nakakatulog, eating, sleeping, etc. Okay, cleared. They go back to work, and cognitively, because they are still impaired, they don't
Mm-mm.
do well.
Yeah.
And it affects quality of life, it affects other people's work, etc.,
Right.
etc. So very important to note that not because you have treated the depression per se, the last to go, the last to improve would be residual symptoms. And there are
Yes.
further implications of residual symptoms. If that is not fully cleaned up, so to speak, no, we don't sweep it well, that becomes a predictor for quick relapse. They
Mm-mm.
go to relapse more quickly
More
than
quickly. Yeah.
somebody na total remission. Okay,
Mm-mm. Yung cognitive domain, Ed, is a late development in terms of our understanding of depression,
that's right.
hindi ba?
Oo. Oo.
In the past, nung batang-bata pa tayo, we understood we understood
Not too
depression.
long ago. Not too long
Not
ago.
only oo, we understood depression as a mood problem, meaning
Right.
nalulungkot, 'di ba? So baka
Oo.
depressed. Now we're understanding that depression is much more than that and that the cognitive function is actually one of the domains that can actually predict response to treatment. The ones
That's right.
who respond better in terms of cognitive function, even in the early phase of treatment, mas maganda ang prognosis niya.
Prognosis.
Oo,
Correct.
'di ba tapos sinabi mo na nga, so, yung illness recurrence mas mababa ang
Bilis.
incidence
Oo.
kapagka, maayos yung cognitive function. But I guess for the lay, audience that we have tonight, we have a few doctors in the audience as well. Um What is striking, I think, is yes, they call it brain fog, but brain fog in depression is actually cognitive impairment. And
Deficit.
it is the
Yes.
thing
Oo.
that affects lifestyle and performance sa trabaho, no? So may mga corporate partners din tayo who are with the
Oo.
audience tonight, and HR practitioners who may also be listening, that one of the
Right.
things that we need to pay attention to will be this cognitive domain and how they manifest at work. Siguro
Correct.
before we go back to the COVID questions na nakikita ko sa
Oo.
chat, just finish this conversation about cognitive impairment in depression
If
and
I may, Lou.
effects on
i-
quality of life.
Yes. And not only that, kumbaga, it's an equal opportunity what you call this illness, because it
Mhm.
occurs whether you're young, you're middle age, or you're older, no? And it happens during the current depression and in supposedly remitted depressed patients. So
Mm.
it could linger, in other words. And if we are not giving full treatment in all the domains, we might miss out, and the patient continues suffering in terms of quality of life uh, and functionality.
Mm. Pagdating sa workplace, siguro one of the things that we'd like to emphasize here to help everyone going through this journey is how does it then manifest as an employee or a manager's behavior at work? No, there was a video that was shown earlier that was provided by Lundbeck that really showed changes in attitude and behavior of particular individuals, and this can really happen and
True.
noticeable at
Right.
work. We will show that video again when we end this conversation. Pero one of the things that we'd like to call your attention to is that the workplace is a very potent venue
And you.
for identifying healthy individuals who are going through the early phases of depression. Kasi
And it has
mararamdaman
greater
natin
impact pagka na-treat, di
oo.
ba? Na-identify and treat. Ang laki ng impact.
That's right. So we really encourage HR and managers and co-employees, peers to actually be cognizant of that. Minsan kasi it will come out as irritability or absenteeism. Yung dating ano,
Okay.
may series of nalilate siya, 'di ba? Or not being able to meet deadlines.
Right. So, for
And
example, somebody who's depressed may actually, di ba, one of the cardinal symptoms is not just feeling depressed, but they will lose interest in their work or their social
mm,
activities. To the co-workers or to the boss, ay nako, indifferent siya. So, i-grade ko yan ng thumbs down.
ibababa mo sa performance
Yung,
evaluation.
correct. Difficulty in concentrating, kasi that's the a symptom of depression
Right.
or very slowed thoughts. Outside, the coworker and the boss will see the patient as laging pinuput off yung mga nagmi-miss ng deadline, or worse, they meet accidents kasi nga poor ang concentration.
Of
Kung driver
concentration.
yan, 'di ba? Kung
Mm-mm.
merong forgetfulness or trouble in remembering stuff, then they will seem to the boss as scatterbrained, 'di ba?
Right.
Or absent-minded professor 'yan, parang ganon. And if
Mm-mm.
they have trouble making decisions, obviously outside yung coworker or the boss will see them as a procrastinator. Quite
Mm-mm.
sad, no? Or ayoko niyan kasi indecisive yan. Or of course, they will not have much productivity. So very slow ang kanilang productivity. And sadly, to somebody who's depressed, with all of these things happening, they will feel either worthless or hindi ako bagay sa trabahong to. And the more makikita ni boss as no confidence, they lack ability and ifa-fire na lang, which is sad, no? If we
Mm-mm.
get to the bottom, the message really is iba yung experience ng somebody who's depressed at yung manifestation to somebody just watching from outside.
Right.
And the message is really for us to sensitize ourselves to the plight of somebody who may experience depression,
Hmm.
particularly in workplaces nga.
So we really encourage the audience to seek out help. No, if you're not feeling all right for some reason and you don't understand why these things are happening to you, brain fog included, lack of attention, sleepiness, or insomnia, I think it's worth giving or reaching out to a mental health professional. Mind Care Club is an online telepsychiatry, telemental health platform, and we've offered our services to corporate partners so that it's easier for HR and corporations to actually refer people to ano kasi ngayon ang hirap mag-book, for example,
Oh,
ng
true.
psychiatrist like kunwari Ed and
Mm,
myself, with COVID ang daming clinic time na
sobra.
nawala face to face,
Oo.
'di ba? So we've all moved into tele. And so Mindcare has maintained the tele platform for that purpose. So the nice thing about what we're talking about here is that depression is actually something that we can treat. Merong
That's
available
right.
treatment for depression.
Yes.
Meron ding available treatment for what we now call brain fog or the cognitive dysfunction that happens or cognitive impairment. So siguro we can address the concept of treatable depression. Ano ba ang ginagawa natin when there is the cognitive disability or dysfunction that comes with depression?
Well, obviously, our paradigm has always been biopsychosocial.
Right.
Although, medyo na put into question, alam naman natin to, Lu, no, na yung the reason why antidepressants work. Nevertheless, it doesn't
Does it
prove
negate
anything.
that it
It
works?
doesn't negate. It just says that what it means lang is which we have said all along and which we are still pat on is that depression is in fact heterogeneous.
Right.
So hindi lang naman yun yung pure explanation. In fact, marami ng like inflammatory condition ng
Inflammatory
depression.
processes, oo.
Yung it's related to stress, the stress diathesis model. So there have been different theories on the causation of depression. So one study that shows it isn't about serotonin doesn't prove that medicines don't
Ah,
work because
right.
we have seen it with our own eyes and patients do swear by their antidepressants. Now, not all antidepressants are the same in the
Correct.
sense that may iba-ibang efficacy kahit yung if you put them together, yes, according to yung mga network meta-analyses that compound the numbers and strengthen the numbers, makikita na seemingly talagang lahat naman efficacious once
Mm-mm.
it's out in the market. However, if you look more closely, now they're using other statistical methods. Hindi naman talaga exactly one, 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 pare-parehong ano nila, yung kanilang what they call now standardized mean differences. Magkakaiba. So there are qualitative or slight quantitative differences amongst the different antidepressants in terms of efficacy, tolerability, and so on and so forth.
Mhm.
No. Now, with regards cognition, uh, to be honest, marami ng pinag-aralan. They have refocused on that and they have done quite a number of studies focusing on cognition in depression. For
Right.
the majority of the antidepressants that are available, uh, it does help, but in an indirect manner.
Right.
Save for, and so far, sa data na na-review ko rin, etc. And I've been fortunate, yun nga, when you speak for different antidepressant companies, obviously you have to be fair and you have to look at their data talaga and the studies.
Mhm.
Isa lang ang may direct effect. Not just because it treated the depression, but right off the bat, it will improve already the cognition, even as it is treating pa lang the
The
depression per
depression,
se.
oo.
Oo. So merong ganon, and that gives us hope because as we said, and by the way, just to be fair, no, in in one of the clinical practice guidelines in the US, particular to yung mga users ng mga HMOs, they in fact elevated in the CPG. That means clinical practice guidelines, and that's highly evidence based. That in this case, vortioxetine is the only one that has a direct effect on depressive symptoms with depression with cognitive symptoms.
Right.
So
So I
that's the
that's very important, no? Kasi when we say depression is treatable, we're actually talking about the three domains of symptoms in depression. And part of that is the cognitive impairment that happens. The cognitive impairment is both a symptom and a consequence of the illness in this case. And the medications treat both the depression and the cognitive impairment. Pero yun nga, ang sinasabi ni Doc Ed Tol kanina is that hindi lahat ng antidepressants pare-pareho. So you really have to consult a health professional to be able to understand and to find the best medication for your cognitive impairment secondary to the depression. And the data is very clear that currently the medication that works directly on the cognitive impairment and the depression at the same time is a product called vortioxetine. At the end of this conversation, there is going to be a QR code that you can take a photo of and then open the link to give you more information about vortioxetine because it's our responsibility to provide that information to you. Um, it's not an over-the-counter drug. I must emphasize that it has to be prescribed by a doctor. So you need to consult if you have any of these symptoms. No. Um, Now, before we talk about the other treatments, let me just pick up. Meron kasing series of questions na dinaanan natin kanina. So there's
okay.
one question from Manisha Kemlani. For post-COVID, how long does brain fog, depression, and anxiety last, especially for the elderly? And I would surmise that elderly means 65 and up, no?
As we mentioned, this is still a moving target. We are finding more and more information. Earlier, I mentioned in general, so in long COVID, as much as a fifth will last for around 5 weeks, and a tenth, 1 in 10, will last for 12 weeks. But that is not necessarily specific just to brain fog. So
Right.
it might be a combination of sorts. So there may be respiratory symptoms. There, a third generally of these long COVID patients, a third would usually have either a psychiatric or neurologic symptom. We are still getting more and more information as to how long. It doesn't seem to be permanent though. okay, which differentiates it from the more difficult cognitive disorders, such as, for example, dementia, as we mentioned.
Dementia, right. Another question from Marcel Balau. Are the development of symptoms in depression and brain fog same in their onset of action?
How's that again?
Brain,
The
are the
development.
development of symptoms in depression and brain fog same in their onset of action? I guess in their occurrence, like when they start.
Generally, as we mentioned, just to clarify, we are using the term brain fog to describe, as an umbrella term, a generic term, the cognitive domain of depression. So they may coexist, in fact, with the emotional as well as the physical symptoms.
Right.
However, as I mentioned also, they may be the last to improve. It may occur during the acute phase. However, it may remain despite remission. And that's
Right.
the reason why we should have due diligence in following up not just the emotional, not just the physical symptoms, but really check also on the cognitive domain of
Mhm.
patients, because that is the one that will predict most the patient's functionality at
Functionality,
work,
right.
in school, and on a personal level.
Yeah, there's a follow-up question again from Marcel. If you have depression, which of the three domains will manifest first?
Generally, and one of the first in terms of what the patient might actually feel would be the emotional, but what they may experience first might be the physical, and commonly it's sleep. In fact, patients who have remitted, one of the first things that are red flags for us would be if the sleep or the physical symptoms start getting affected. Then there's a cascade of the other symptom domain. Emotionally, they will not feel well, as we mentioned. Even if you didn't have depression, diba, you're not sleeping very well the next day. You're brain fogged. You are also irritable, and so on and so forth. No, physically you're weak. You don't want to do exercise and all that.
Mm.
So
Mm.
um, depends on what other people will notice, perhaps the emotional aspect, but really the one that will be picked up initially, one of the first that will signal that there's something wrong, might be sleep, especially for a few nights. It's happening, then everything will cascade down to the cognitive symptoms.
Mm. Yep. So they all come in one basket. So really,
One
the
bad.
assessment becomes very, very important. Now, for Dr. Anderson, is vortioxetine now available in New Zealand? Yes, it's available, but I'm not sure if it's funded, because not all the medications are funded. But yes, it's available. From Adri Amante, are there certain activities that we can engage in to help sharpen our cognitive function? Yun nga yung next part ng discussion. Yung ano, when experiencing things like brain fog. So, we talked about medications earlier. Now we will talk about the other things that can be done in order
The
to deal with
psychosocial.
fog, no? Yung psychosocial aspects of it. So, part of the discussion will really be, aside from medication, lifestyle. At sa lifestyle, kasama dyan ng sleep.
Right.
No?
Well, first and foremost, we have to qualify that there will be no quick fix sa
That's
brain
right.
fog, whether in
Mm-mm.
depression, after COVID, and so on and so forth. No, however, it will contribute if you started it, Lu. No, you get enough sleep, because we know how imperative it will be, especially during these times, that we get enough sleep. And it might be good that you actually go into a regular sleep time and regular wake up time, even through the weekends. No, And ideally, as much as possible, it's uninterrupted, no? So you sleep through the night. If your problem is having to go to the toilet, look at the main cause. If it's hunger, then have a glass of milk before sleeping. If it's going to the toilet, perhaps during the day, morning, you drink more than in the evening. No, so practical things. We
Mm.
mentioned exercise. Yes, exercise would be ideal, but we know that one thing that happened during the pandemic is we couldn't go out. Our governments wouldn't allow us even to run at the beginning, at least, no,
Mm,
to run
mm,
outside, etc., because we didn't know what was causing all this. However, what we have I'm part I think Lou mentioned this. I'm part of an organization called Philippine
mm.
Association for the Study of Obesity and Overweight, and we have been trying to promote a program which is doable, particularly in the context of the pandemic when you're working from home, and it's called CPA. To those from New Zealand, SIPA is actually kick, but it's an acronym for short, um, incidental physical activity. So what is that? If you're working 8 hours a day on your computer, you just have to stand up every hour on the hour, walk around for 3 minutes, or stretch, or go to the restroom, or go to the ref to get water. If you have stairs, go up and down. 3 minutes, all it takes. And you multiply that, you have 24 minutes within a day. And in 5 working days, that's over an hour. So you have practically accomplished what you need to do in terms of physical activity,
Mm.
and your smartwatch will thank you for it also.
It
And
will
will score
it
you.
will alarm actually to remind you to stop
Exactly.
and walk. Yeah.
Exactly. And of course, we mentioned for kids, for example, high sugar will also cause brain fog and all that. Eating healthy is very important because
Mm,
certain foods are inflammatory. And we already mentioned inflammation, whether we're talking COVID or depression, can be causes, no? Are causative agents. So they have in certain literature mentioned, and actually a lot of literature highlights Mediterranean type of diet, which is the least inflammatory. So uh, green leafy vegetables, more than more than red meat, and so on and so forth. And of course, avoiding the negatives: alcohol, different substances, tobacco, vaping for kids out there, usong-uso.
also
They
yan, oo.
they will certainly impact the brain, the way your brain works. No,
Mm, mm.
alcohol is a brain depressant. So you know this. Once you've taken over your usual amount of alcohol, you're not thinking very well. So
Mm,
clearly, that's important. And of course, when we're talking health in general, we need to learn how to manage our stress. Some
mm.
stress is not a bad word, by the way, because some stress can be positive
That's
when it
true.
motivates us to do the right thing, to work at our exercise, to do things. That's still stressful, but it's positive stress.
Mm,
We are focusing on really negative stress or distress or slash burnout. Okay, because that is already leading to impairment very soon. We have been pushing for other kinds of quote unquote exercises, like mindfulness exercise,
mindfulness.
just focusing on the here and now. Chill ka lang. I mean, don't worry about the past. There's nothing you could do about it, and the future is nebulous like anything, and we don't have any control over it. So let's focus on just the here and now. And yoga, of course, is a popular exercise nowadays. Then, of course, I gave a talk on 10 important building blocks for resilience, and one of the number one, in fact, is, especially in the context of the pandemic, is really reaching out and having social connections. In as
Right.
much as, and I know there are doctors out there, PR people, and all that, in as much as we help other people during times of crisis and when you need it, it's also important to reach out and ask for help. So it goes two ways, the social connection. That's quite important, no? And related to this is, I'm sure a lot of us did this during the pandemic, coming up with new hobbies. Ang daming plantito,
O yung mga
plantitas.
plantito, plantita.
uh, I had I tried going into languages. I tried to learn. I know. So now I'm also looking forward to traveling and so on and so forth. Or other hobbies, painting, for example. You might think you don't have it in you, but try it out. Also, once you do those, sometimes you get connected with other people with shared
The same
interests, and
interest,
again,
right.
nakaka-stimulate ulit ng brain natin.
So talagang importante, not just medications. Medications are pillars of treatment, pero
Right.
kailangan din holistic, no, yung ating
Very.
lifestyle. So pay attention to your sleep, what you eat, the choices you make in terms of what you eat, and the level of physical activity. So ang tawag ni Ed dun sipa. Pinag-usapan namin yung kanina, sabi
Sipa.
ko, ang tawag ko naman dun micro breaks, 'di ba? Kasi you don't wait to leave for a holiday for 1 week or get off work for 2 weeks. Sometimes you
True.
really just have to take little breaks while you're at work. So 3 to 5 minutes of every hour is a micro break. There are still questions coming in. No, one is from Jamie Duran. Hi, Jamie. I've had COVID-19 twice and noticed that I have brain fog more than ever. Though my psychiatrist said it might also be because of my medications. What can you suggest on how to live with brain fog? Thank you for this.
Well,
So
when
it's
it
how to
if
live with brain fog. That's
uh,
assuming hindi mawawala yung brain fog. But Ed and I still believe
uh,
that brain fog is something that can be dealt with.
in fact, it might what I want to say could be related. First, you make sure you have achieved remission, because that's an important thing, and that's a goal. In
Mm-mm.
any treatment, I don't know what your diagnosis is, but really, you have to reach remission. It is not just response. Response is just having, half of your symptoms gone.
Go away.
The idea is way beyond. It's really remission, and after remission, recovery, meaning you have sustained your remission for a couple of months. Second, and I'm glad you're asking this question, it might be important to find out if there are sub-threshold symptoms, either of the depression itself, or you might have, which is the third, a comorbid anxiety, etc. The thing about psychiatric care is that if you're not treating everything and you leave some residuals behind, it still kind of anchors you to certain problems, no? In this case, we're discussing cognition, but
Mm-mm.
also obviously that will affect your quality of life. And then try as much as possible to regain your usual physical activity, whatever it is, whatever you did enjoy, and to the level that you did enjoy. But mind you, of course, to your realities right now. Kasi yung iba may have, for example, problems with breathing or easy fatigability. So little by little, and get medical clearance for that. And of course, we already highlighted ni Lou the rational use of drugs. I'm not just focusing on one drug. If there's a need, for example, to treat also the anxiety or other comorbid conditions, use it rationally. When I say rationally also, it may mean um, some usually may give a lot more benzos. I'm so against that if
Yeah.
they are not anymore rational. Why? Because Benzodiazepines, what I'm talking about are,
Mga
Valium,
diazepam,
mga
lorazepam.
diazepam, oo, yung mga pam, 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 no? The problem
Mm-mm.
with that is that they will slow down thinking process.
Right.
This becomes even more obvious sa mga elderly.
Mm-mm.
Uh, the next day pa lang, you will see that they cannot recall what day it is.
Mm-mm.
Sometimes they look at you blank,
Blank. Mm-mm.
and they don't necessarily have dementia. It's just
Mm-mm.
because of the residual effect of the benzo. So rational use of drugs is something I'd like to emphasize. No, kung kailangan, of course, pero once you have outlived the usefulness, then stop. There are also some, for example, when being given antipsychotics, kung I don't want to be too anticipatory of extrapyramidal side effects, because when you add the anti-EPS medications, that will slow down also the thinking. So I'm very, very conscious about, making sure that my patient could go back to work in the soonest possible, or school. And then,
Mm-mm.
of course, if it's depression that we're talking about, make sure you have antidepressants
In the
because
mga medication
doon sa
regimen.
mga binibigay sa iyo, no, and usually we try to follow clinical practice guidelines. So first liners muna rather
Oh,
than yung mga second line,
second
because
or
why
adjunctive.
go for second line, when you have very strong evidence for the first liners. And of course, and Lou and I were discussing this, yung mga cognitive and functional remediation exercises, ang one word lang dyan that I'd like, because um personal story, I'll share this. My mom has beginning dementia,
Uh-uh.
but I tell you, she could play on the iPad yung kanyang word game practically the
Uh-uh.
whole afternoon. But I found out memorize, hindi naman memorize, pero rote by rote, alam niya na yung
Pinaka-pisote.
oo. So it's important na meron kang games pero hindi same old, same old. Try
Oh,
to vary the games.
very, yeah.
Try to find yung medyo, kung kaya mo na, go for something a
Go to
little
the
more
next
challenging.
level. Correct.
Oo. So, yun yung mga general especially if you have both depression and cognitive issues.
Right. Another question from Camila Cabello. What can be done with frequented hypnic jerks that wake you up several times at night that cause sleep problems, eventually leading to insomnia? So I guess this is some kind of a restless leg syndrome.
Restless leg syndrome. And we have to know that some of the restless leg syndrome can be also the cause of some medications.
Right.
So, best is to find out the cause. So, discuss this with your treating doctor. It might be one of the medications being given, amongst other reasons, no? And it's a medical decision. It might have to be decreasing or changing the medication, and so on and so forth.
There are several possible explanations kasi for what you call
Uh,
hypnic jerk, especially if they
Hypnic
happen
jerks.
while you're asleep. So I
Correct.
guess it is important to have yourself assess, no? So sometimes it's not really because of a mental health issue, but it can
Correct.
be, especially if it
Mm-hmm.
goes with nightmares or very vivid
Mm-hmm.
dreams in the evening or night sweats. Yun pa yung isa.
Right.
um but there are some medical problems that you also have to deal with when you have this. So
Correct.
do consult your doctor. If it is a mental health problem, do consult us at the Mind Care Club, and then we can probably help you in a more detailed way, more direct to what you're going
Correct.
through. So I guess we really have run out of time. Actually, we went over time. No, this
Ah, we
usually is.
did. Ah,
Yeah, we
okay.
did. It's usually just a program that runs for an hour, but we're now 14 minutes over time. I'm not sure, did we answer all of the questions? I think so. And then there are several other comments which I encourage you, Ed, to maybe go back and read in the chat. But before we go with, I'd really like to say thank you very much to Dr. Ed Toll Ed Tolentino is a practicing psychiatrist at the Makati Med, but is also the chairman of the Department of Psychiatry at Quirino Memorial Medical Center. And thank you very much to Lundbeck for partnering with us in celebration of World Mental Health Day, which is now really World Mental Health Month. And we'd like to say thank you to the Mind Care Club and everyone who's participated tonight, all the comments and the audience that have been very active. And then maybe Ed, for some closing in terms of if there's anything you'd like to tell the audience as we bring this program to a close.
I think one of the highlights of our talk on brain fog, we connected it with the pandemic and all the difficulties we've had. Um, Having discussed this tonight and focusing also on depression as a condition, we know that, and we are hopeful because we know that for the most part, a lot of these conditions are in fact treatable. So the message is really first, let's find out what the main cause would be. There is help available, okay? And here you are with Mind Care, and there are medications that are available, very specific to helping individuals with brain fog or the cognitive dimensions of depression. And thank you for this opportunity, to one and all for having me here.
Thank you so much, Dr. Edgardo Juan Tolentino, laging maaasahan, isang mabuting kaibigan. Thank you very much
My
to Syra
pleasure.
Angeles for the support. And we look forward to celebrating again, same time next year. Hopefully, we will continue this meaningful partnership with Lundbeck. Maraming salamat po. At bago kami mag-brain fog ni Dr. Tolentino, magandang gabi sa inyong lahat.
Magandang gabi sa inyo lahat. Thanks, Lou.
Thank
Thanks,
you.
everyone.
Said, bye.
Night. Bye. Good night. Tulog na.
Thank you. Thank you. Congrats, man. Thanks, man.
Thanks, thanks.
Good job, man.
James, can I share with you
Hey.
this?
I'll get to it, okay? Just give me some time. What is it with these headaches?
But they're like selling some like tourist like gifts.
Hey James, do you want to go and get lunch?
No. shouldn't be so hard.
Ma, I think I need help.
What's the purpose of life?
Hi, James. How are you feeling today?
I'm better now.
It's great. Do you feel any sad feelings going on?
Less and less. Now I try to talk to my friends more.
Finish up with the fist bump.
They produce the emotions that make us tingle. They govern how we share our excitement. Even the memories we form and recall rely on the billions of connections in our brain. But all it takes is a tiny imbalance in one chemical messenger, or a single signal out of place, for thoughts to become jumbled, or for memories to disappear altogether. For us to feel our world dim, slowly turning into darkness. To disconnect with our own body. Or to make us lose trust in reality altogether. While the challenge is immense, it cannot be left unsolved. Every day we work tirelessly to flick the switches on brain disease. Decades of hard work and commitment have taken us far. And while there's still a long way to go, we keep pushing forward in search of better treatments. Because one day, we hope the light will burn bright for everyone.